Namaste and a very pleasant welcome to the third episode of COVID Care Series by Apollo Experts. Today we have Dr. Suneetha Narreddy, infectious diseases specialist at Apollo Hospitals. She has close to 2 decades of experience, and in her own words, she's passionate about medicine and compassionate about people. Today, she's going to talk about COVID-19 tests and accuracy. Over to you, Dr. Suneetha.
So when we talk about COVID testing, there's always a question of what are these tests? There are so many different terminologies that we use. What do each of these tests mean? RT-PCR, TrueNAT, antibody test, rapid antigen test. So let's try to understand what these mean to us. Broadly speaking, you can divide tests into 2 different categories. The first category are tests that are done to see if you have the infection or disease at this point in time. The second category is to see if you have had the disease at some point and have antibodies to the disease, which means do you have a protection to the disease. So broadly speaking, these are the 2 categories. Let's talk about the first category, the diagnostic test to see if you have the infection or do not have the infection. All of these tests pretty much use a standard common thing where you take a swab and put it into your nose, into the back of your nose or into the back of your throat and take a sample from the affected area and do the test. So it can be a rapid antigen test, which is a test that is, which is a technology that is used primarily to give a rapid answer. These are usually based on as screening tests, whereby if it is positive, it means it is positive. But if it is negative, you still have to do the confirmatory test, which means the sensitivity of the test is low, but the specificity of the test is very high. So positive means positive, but you can have a false negative test. That's a rapid antigen test. Of course, in other countries, they have other rapid tests which have a better sensitivity. In India, we use the rapid antigen test. Apart from this, we have other tests which use the molecular diagnostic technology to diagnose COVID. Again, this method of collecting the sample is the same. They put a swab into the back of the throat or into the back of the nose to collect the sample. And these samples can be processed by different technologies. The 2 common things that are used in the country at the moment is the RT-PCR or something called TrueNAT or GeneXpert. Now, what is the difference between the 2? TrueNAT is a less labor-intensive technology, can give you a report a little faster, but can only do few samples at a time. So if you want a faster answer, you can use it. However, you can't process large volumes at a time. Whereas with RT-PCR, in RT-PCR, what you have to do is extract the DNA out of the sample and then process it. So the technology is much more advanced in the RT-PCR test, but with various machines that are available, this is more streamlined and you can process large samples at a time. So these are the basic diagnostic tests. So the screening test or the easier test is the rapid antigen test. The confirmatory test is the RT-PCR or TrueNAT that is commonly used in India. What about the antibody test? A lot of people talk about the antibody test. These are tests that are done on blood, not in the nose, not a throat swab or a nasopharyngeal swab. These are a blood test where they look for antibodies. Body develops antibodies to the human body develops antibodies to any infections. In this case, we are looking at antibodies specific to the SARS-CoV-2 virus. Okay, the COVID antibody tests helps us identify if people have been infected with SARS-CoV virus or have recovered from the SARS-CoV-2 infection at some point in time. Okay, So if you have a positive antibody test, that means you have had infection at some point, or you have had the vaccine at some point. Okay. Then the question comes, does the positive antibody test mean I'm immune to the COVID infection and will never get a COVID infection again? A positive antibody tells you that you have an antibody, but again, based on what is circulating in the community, you may or may not be protected for a new kind of a strain. And also the antibodies may not last long enough. Typically with their infection, the antibodies last in the blood for a couple of months, usually about 3 months. With the vaccine, maybe a little longer. 6 months is a general ballpark figure we are talking about at this point. What if you have a negative antibody test? Does that, even if you have had COVID infection, that does not mean you will always produce antibodies. But most of the time, if you have had an infection, you would have antibodies. Okay. So there are terms that I have used. What sensitivity and specificity. What does this mean? Sensitivity of a test is the ability of the test to tell you if you have the disease or not. Okay, which means if I have antibodies, for example, and I've had the infection, that is a true positive. Okay, some tests are very sensitive and will be able to identify the disease very well. Some tests are not very sensitive, but are very specific. Typically for screening, we use something which has a high sensitivity, although you may miss out a few, few that have the disease. Okay. So you can have a false positive or a false negative test in any kind of a testing process. If you have a COVID-like illness and you have tested with the rapid antigen test, and if it is negative, that may be a true negative or it can be a false negative. Which means if you have symptoms suggestive of COVID in this day and age where the prevalence of the disease is very high, you have to follow the test by a confirmatory test, which would be an RT-PCR test. Okay. Even if your test is negative and you have symptoms, ensure that you wear your face mask at all times so that you will not spread the disease to other people. And always consult your doctor when in doubt. Anytime you have symptoms, please consult your doctor for the appropriate testing and the investigations to be done. So I will stop here and take any further questions that you may have at this point.
Thank you, Dr. Suneetha. It was very informative. You very well explained what's the difference between sensitivity and specificity. I think it's very important for the public to understand on what terms, how we are deciding, which test has to be taken and all of that. So thank you for that. So we have a few questions. The first question is, you did explain who should get tested, but what is the correct time to do the testing?
So there are two ways to look at this again. If you have symptoms suggestive of COVID, if you have a cough, if you have a runny nose, if you have a sore throat, if you have fever, any of the symptoms, you need to be tested for COVID at that point in time. If you have a negative test, do not be with the impression that you don't have COVID, because the sensitivity of any test is not 100%. Like the rapid antigen test, the sensitivity is about 50%, which means you can miss about 50% of the people, even if you have the disease. With the RT-PCR, the sensitivity goes up to 70%, which means it will pick up 70% of the people with the disease, but can still miss a few people. So it is important that even if the test is negative, you do have to follow appropriate precautions so that you do not spread the disease. And also consider repeating the test as guided by your doctor. Typically, usually we repeat it after 48 to 72 hours. The other time you would do you have been exposed to COVID from other people. Okay. So somebody in your, say if somebody in your family has COVID, then the question occurs, when do you want to test? If you're asymptomatic, the most important thing is making sure you're quarantined, because you can still be spreading the disease even though if you you don't have symptoms. But if you're asymptomatic, you can defer the test up to 5 to 7 days. The highest pickup rate for an asymptomatic person is typically around 5 days. So you can defer the test. But if you do have symptoms, you should test at that point in time.
You did explain about how the RT-PCR is done and antibodies and antigens. So if we have to understand in very simple terms, what is the difference between a molecular test and an antigen test?
Okay. So in an RT-PCR, the simple thing is you extract the DNA. You take the sample, there's some chemical processes that are done. You extract the DNA and try to match it to a sample of the DNA from the specific virus you're looking for. In this case, it is a COVID test or COVID-19 or the SARS-CoV-2 virus. You take a small bit of that virus and you match it to the DNA that you extracted. In the rapid antigen test that we have, you're looking more about the antigen, which means typically when you have an infection, you develop certain antigens also in the body. You're looking at the antigen, which is why, because you're not looking at the DNA and the antigen can take time to form, it can take a little, your sensitivity is a little lower. But the advantage again with the rapid antigen that we have is you can get a report in 15 minutes. And that's makes it so convenient. So that's the reason why we use a lot of that. But if you have symptoms and it is negative, please do not consider the test is negative and go on like that. You need to repeat either a RT-PCR or a TrueNat again. And also what happens is some people do one test, it is positive, and then say that, oh, I don't have symptoms. My symptoms have, or rather, my symptoms have gone. I want to repeat a test in 24 hours and see that it is negative. And then believe that the first test may be false positive. It is very, very unlikely to get a false positive antigen test or an RT-PCR test unless there's a gross contamination in the system that has been collected in, which is very, very unusual. In which case the whole batch will be positive, and that automatically means they have to repeat the test. Okay, it's extremely unusual to get a false positive. If positive means it is positive. It is possible that you don't have the virus in the next sample. That can happen, but a positive is a positive test.
Thank you, doctor, for explaining that, because it covers our next question, what is false positive? So if you can tell a little bit about false negative, and what is the most preferred test by the doctors for COVID-19?
Okay. So, like I told you, the sensitivity of the rapid antigen is about 50%. So if you have the symptoms and the rapid antigen is negative, and you follow it through with RT-PCR or sometimes say CT chest. CT chest is done also a lot for diagnosing COVID. So say your rapid antigen or RT-PCR is negative, but the CT is showing features of COVID, then it means that the rapid antigen or the RT-PCR is false negative, because again, the sensitivity of rapid antigen is 50% and the sensitivity of RT-PCR is 70%. So when you combine all these modalities, it gives you a higher probability of diagnosing. Again, there's another symptom. For example, if your loss of smell is almost as equal to RT-PCR in terms of telling you that this is COVID. So if you have loss of smell, it's given that you have COVID, irrespective of the test. So if you combine a lot of these techniques, your ability to diagnose the disease goes higher. So false negative by blood test or by a nasopharyngeal swab, but confirmed by a CT chest, proves that that is a false negative, which can happen.
So you did talk about the antibodies, saying you may have positive antibodies when you do the test. That means you do have some sort of immunity against the disease. It could be whether you had the disease in the past or through vaccine. So when you say positive, what is the value that one should have? Then you feel, okay, this is fine.
That's a very confusing thing to most people. Okay. Depending on what antibody test you do, depending on the kit you have, each antibody kit will have a different range. There are different antibodies that are also being looked at. There's a neutralizing antibody, there's a spike protein antibody. There are so different kinds of technologies are there even in antibodies. By and far, if you have a positive, it means it is a positive. The number is not as significant. It can help that, okay, if I have a higher number, maybe antibodies last longer, but all that is actually immaterial. If it's positive, it's positive. If it is negative, it is negative. Similar to how you talk about the CT value in RT-PCR. All of these numbers really have limited clinical significance. A positive antibody test means you've been exposed to the virus at some point in life, or you've been exposed to the vaccine and you developed antibodies. It does not mean that if you have a higher antibody, you will have a higher amount of protection, and if you have a lower antibody, you'll have a lower amount of antibody protection. No, that is not the right way.
Yeah, thank you for that. So that is partially answering my next question. How accurate is the antibody test? So from what you tell, as long as we know that the antibody test is positive, there's some sort of protection.
Let me stop you there, Padma. So, okay, if I have COVID and I have antibody, and then I take a vaccine and I recheck and I have antibody, does that mean I have a protection? Absolutely no. You can still develop the infection in spite of having high level of antibody. In fact, people we are seeing in the hospital right now. We also have to remember that this COVID keeps undergoing changes. Any virus that you know of, or any living cell that you know of, undergoes what is called as mutations on a regular basis. Okay. So when these mutations form significant changes to the structure of the virus, we call that as a mutant strain. And we do know that there are mutant strains that are there in the community in India and across the world, various different mutant strains, whereby the current, even if you had a previous infection, even if you had a vaccine, does not mean it offers you 100% protection. You can develop the infection. Now, having said that, vaccine, if you have had the vaccine so far, whatever strains that we are seeing, is protecting you to a certain extent whereby you will not develop a severe disease. And that is important for us to understand. So vaccine is still important, though you may not have 100% protection in terms of developing the disease. Vaccine will help you prevent from a serious or prevent the severity of illness. So you will have a mild disease, but not a severe illness. Having taken the vaccine, and even if you have antibodies, you can still get the infection and you can still transmit the disease. So you still have to use precautions, because vaccine will prevent a severe illness, but you can still have the disease in your upper respiratory tract. So please take precautions even if you've taken a vaccine.
Okay. So can we safely say that if I have antibodies, it's not that I am immune and I will not be getting reinfection?
No. If you have antibodies, you can reasonably be certain today that you may not get a severe illness, but you can get a reinfection. You can have infection and vaccine and still can get a reinfection. It is possible.
So now, touching upon the vaccine, now I have taken my vaccine and I've tested positive.
So,
thank you.
So that's a very important thing to clarify what I've just been talking. So when I say that you have the vaccine and you still can develop an infection, the next question is, why do I take a vaccine if you're telling me that I can get an infection anyways? That's where you're leading to. So if you have taken a vaccine, you will be protected against severe illness. You won't die of COVID. You can get COVID infection, but you're unlikely to die from COVID infection. And that makes a huge difference. And that is what we're looking for from the vaccine. The primary goal of the vaccine is to prevent death. The vaccine has achieved its purpose. Okay? So you still take the vaccine because the vaccine is likely to prevent you from dying from COVID. It is not meant to prevent a mild infection. The vaccine is not meant to prevent a mild infection, and that can still happen.
So the next question is, I had my first dose of COVID vaccine and I developed mild symptoms after the first dose. And within a gap of 10 days, I developed symptoms and I tested positive. Do you think that test is accurate?
Okay. The COVID vaccines we have currently are Covishield and Covaxin in the country. We may get more vaccines in the near future. Now, either of the two vaccines, with one dose, your probability of getting protection is a little over 50%. With two doses, it can go between over 70%. Any vaccine, for you to develop a protective effect, typically takes between 2 and 3 weeks. So if you've taken a vaccine today, there's a 50% probability you can get some sort of a protection in about 2 to 3 weeks, or in about 3 weeks. After 2 doses, and then after about 3 to 4 weeks of the second dose, your probability of getting protected goes up to about over 70%. So if you get a COVID infection after the first dose, does that mean failure of the vaccine? No, you can still get infection post-COVID vaccine. So because the vaccine is again designed to protect you only after 2 doses. So if your COVID test is positive after 10 days after the COVID vaccine, it means you have COVID infection.
Right. So does the accuracy depend on the way my sample was collected? As you mentioned, it could be a nasal swab.
Yes.
Does it really depend on the way it is collected, and how do I ensure that it is done properly, because it's not in my hands?
Yes. So the amount of virus is different in different parts of the body. Okay. It is lowest in the throat. If you take a throat swab, your probability of getting the right answer or positive answer is low, probably about 50% for an RT-PCR. If you take it in the nose, if you take it superficially where it really actually doesn't pain, again, the collection technique is wrong. It has to be from the back of your nose, and typically you have to put your chin up, look up, and the person who's collecting the sample will be putting the swab back into the back of your throat and twist the swab. It is a painful procedure. If you're not having enough pain, then it is possible that the sample is not collected properly. Okay, so if you collect a nasopharyngeal swab, your probability of getting the correct answer is about 70%. Whereas if somebody is on the ventilator and if you take an endotracheal sample, that has higher probability of getting a correct answer. So, because again, in the lungs, if you're taking directly from the lungs, your probability of getting the answer is much higher.
Right. So next question is, after completing isolation for 14 days, when is the right time to do the test?
As a general principle, it is advisable not to repeat a COVID test. COVID RT-PCR can be positive for prolonged periods of time, even several weeks to months. That is because viral shedding can occur for a long period of time. It does not indicate that you can transmit the disease. These are usually non-viable virus that is present. So it is advisable by the government of India, by the WHO, by the CDC in US, every other organization, or every single organization, authority in this has clearly instructed, please do not repeat tests because you can have positive tests. So Can you get a positive test? You can, but please don't repeat a test.
So the next question is, I have throat pain for 3 days. Should I just isolate myself or do the test?
I would suggest you do the test because it's important for you to know if you have COVID or not have COVID, because your treatment can be dependent on that. By and far, most people do not develop a severe illness, but if you are one of the unlucky persons where you do develop a severe illness, knowing that you have COVID, or if you have any risk factors, there are things you can do to prevent severity of illness. So it is advisable to get tested, not just for yourself, also because that way you can ensure that nobody around you can get infected by quarantining yourself.
Yeah, the next is asking, I have partial loss of taste for the last 3 days. Should I test?
Absolutely. Loss of smell is very pathognomonic or almost diagnostic of COVID. Loss of taste by itself is not pathognomonic or diagnostic of COVID, but you should look into that possibility as well and get yourself tested.
So is there a certain blood group which is prone to COVID?
There was a lot of discussion about blood group and severity of illness in COVID, but I don't think it really has panned out in terms of rigorous clinical trials. Yeah, there was a discussion, but it has not really panned out. So answer is...
The next question is, we do hear a lot about home testing for COVID in other countries.
Yes.
How reliable are those? Are they going to be available here? Do you know of that?
Home testing is available, fairly reasonably good tests, better than the current rapid antigen tests that we have. There are different varieties of ways that samples are collected. Typical one is an oral, you put a swab into your mouth and get a sample. Research is going on in India for these kind of technologies as well. I know CCMB and ICMR are doing tests in this direction. And I'm hoping that we will get some soon. And CCMB actually has started a different technology of collecting samples as well, and different technology of doing the PCR as well. They collect a dry swab instead of a liquid swab. What we are currently doing with RT-PCR and TrueNat is collecting the nasopharyngeal swab and putting into a liquid viral culture media. Okay, and this viral culture media is actually a fairly expensive media. So they are coming with the technology where they can collect as a dry swab. And the advantage with the dry swab technique is that you not only save on a lot of other costs, you can transport the swab from one place to another. For example, if you're in a remote place where you cannot have the technology to process a sample in the same location, with the dry swab, you can transport it to wherever you have the technology to process it and process the sample. And that will improve our diagnostic capabilities in the districts and sub-district levels.
So you did touch upon what I'm going to make a statement about in multiple ways during your talk. But for a large section of people, they do still think that people are getting COVID because they have taken the vaccine. Please comment.
Vaccine does not cause COVID infection, period. If somebody is telling you that, that is a wrong information. Vaccine, this is not there are certain vaccines that can provide infections as well. Those are called live vaccines. Here, you don't use a live COVID virus at all. So you do not get vaccine-related COVID infection. The problem is, most people, the moment they take vaccine, they think that they're protected, and also because of the increased prevalence currently, when you lose your thinking capability and start behaving that you're invincible and move around, you're putting yourself at high-risk behavior, because you have the false sense of notion that you've taken the vaccine and you're protected. But one dose of vaccine does not protect you. So then you develop COVID because you put yourself in a high-risk behavior and develop the infection, and you blame the vaccine. So that's not fair.
Thank you, Dr. Suneetha. This concludes our question and answer session. It was a very, very informative session, and I hope public does understand now what are the different types of tests and what is the most recommended, and when do they test it, and what is false positive, false negative. Thank you so much. It was very, very simple and clear to understand. Now watch us again for our next session on next Monday, same time. The topic is vaccination facts and myths by Dr. Anupam Sibal, Group Medical Director and a pediatric gastroenterologist from Apollo Hospitals. If you have any more queries, please do reach us at our Facebook Messenger, or you can post comments in the comment section. So until then, take care, be safe. Don't forget SMS. S for social distancing, M, mask is always on, and S is sanitization. Thank you and namaste.